is a preterm or newborn jaundice? It is a yellow discoloration of the skin and the eyes, which can have many causes, but the majority of these infants have a condition called the physiological jaundice. It is a natural occurrence which is caused by the elevated levels of the bilirubin in the blood because of the immature liver of the baby, which is unable to get rid of the bilirubin in the blood. However, this type of condition lasts only for a few days and is easily treatable. As recommended, the baby should be examined for jaundice between the 3rd and the 7th day after birth, when the bilirubin levels are usually at its peak, and look out for the baby's skin and the sclera of the eyes if they have become yellow or not.
History taking is one of the first steps in the medical examination and should focus on newborns' feeding, voiding, stooling, and mental status. Some questions you may ask on the history include age of the baby, gestation period of the baby, and if the baby is exclusively breastfed and the breastfeeding is going well or not, how many times the baby fed in the last 24 hours, has the baby gotten any formula feed, how many wet diapers in last 24 hours, and what is the color of the stool of the baby, is there a family history of RBC disorders, and if the baby has gotten a newborn screen or not. And after collecting the basic medical health and family history, we proceed with physical examination of the baby.
This is Dasari Bindu Bhargavi. Today I am going to examine the vital sciences. Firstly, make sure the hands are cleanly sanitized. Now I am going to look for the heart rate. The heart rate between 100 to 190 beats per minute is normal. Now we are assessing the pulse. Now I am going to assess the respiration rate. The respiration rate between 30 to 60 beats per minute is normal. Temperature between 36.4 to 37.4 Celsius.
Check the child if she was warm or cool, and observe the child if she was awake or asleep, and observe the child whether she was active or not.
The baby who has preterm with jaundice, we have to check the skin color in different parts of the body. If the skin color changes in or looks like in yellow color, we can confirm that we has symptoms of jaundice. And later that we have to check the sclera of the eye, and we can confirm that he has symptoms of jaundice.
Cephalohematoma is a collection of blood between a baby's scalp and the skull, and it is a subperiosteal hemorrhage, so it is always limited to the surface of one cranial bone. When digital pressure is applied, the fullness shifts from under the finger to the surrounding areas. In this picture, a bulge can be appreciated anterior and superior to the pressure point. When pressure is released, blood immediately refills this area and the appearance is identical to the way it was before. An underlying skull fracture, usually linear and not depressed, is occasionally associated with cephalohematoma. The most common symptom of cephalohematoma is an unnatural bulge appearing on the infant's head.
While doing the examination of the abdomen for the preterm baby, we should look forward to that we palpate all the 9 areas. Then, with the help of both our hands, we should palpate for the liver, which is usually not palpable, but it is very close to the costal margin, and spleen is usually not palpable. The presence of palpable liver does not always indicate hepatomegaly. In general, a liver age greater than 3.5 cm in newborns and greater than 2 cm in children below the right costal margin suggests enlargement. Now, the normal range for liver span by percussion at 1 week of age is 4.5 to 5 cm. Hepatomegaly is not always prominent, or splenomegaly is not always prominent in jaundice. of a preterm baby.
You can assess her motor function by observation. Does she move all her extremities well? Is her face symmetric? Sensation can be determined by noticing how she responds to your touch. To test the Mora reflex, hold the infant's hands and pull forward until her head is a few centimeters above the bassinet. Drop her head gently into your other hand.
Her hand should open and her upper extremities should extend and then retract.
The palmar grasp reflex is easily listed by pushing your fingertip into the baby's palm, causing her to wrap her fingers around yours. The rooting reflex is evaluated by stroking the infant's cheek, leading her to start suckling her mouth in anticipation of a feed.
Pathological jaundice. It's developed within first 24 hours after birth. Will be having much higher levels of serum bilirubin. Increases in the levels of total serum bilirubin, that is 5 mg per dl per 24 hours. The newborn is usually sick, pale, feeds poorly and has abnormal color of urine and stool. The most likely cause is blood incompatibility or liver disease. Kernicterus may be present. It is a pathological term refers to the syndrome of bilirubin encephalopathy. Treatment for this jaundice must be initiated as soon as possible.
First-line therapy for jaundice is phototherapy, in which newborn baby is exposed to special lights known as bili lights. Light helps the baby's body to break down bilirubin into a form which is easily excreted by the body. And we have another procedure for jaundice, that is IV.
So the intravenous immunoglobulin injection, it is a blood protein that can reduce levels of antibodies, and it may decrease jaundice and lessen the need for an exchange transfusion.
If phototherapy doesn't work, doctors may suggest somewhat a risky procedure called an exchange transfusion. For this procedure, some of the baby's blood is removed and replaced by the donor's blood.
Jaundice is common in newborn babies. The babies doesn't have a fully matured liver, so they cannot handle the blood from the mother, and there is some difference between the blood group of mother and baby. It is the normal process of RBC. But as we know, a newborn baby's liver is not fully developed, so it's less effective at processing the bilirubin and removing it from the blood. Risk factors of jaundice. There are several risk factors, but these are for preterm babies. Low birth weight, polycythemia, and babies who have affected siblings, and ABO incompatibility and hemolytic diseases.